Hi, my name is Lindsey Rykiel, and I wanted to take this opportunity to explain what health education means to me, what I plan on doing with my health education degree, and why I chose this major. To begin, health education to me is being able to take the knowledge and the learning experience from other health educators and being able to implement that in my day-to-day activities. For me, my ultimate goal is to be able to help anyone and everyone that would listen to me about the importance of health in their everyday lives. All too often, you hear people take advantage of their healthy lifestyles, and it's typically only after something happens to the person health-wise that they'll make some kind of lifestyle change, something to help them for their future. What I want to do is to be able to take that knowledge and be able to help people fix the problem now before the actual problem happens, to prevent the health diseases in the future. Currently, I actually work with a clinical trial partner, and we help patients get their clinical trial medications from pharmacies. So I do work with patients in doctors' offices and pharmacies on a daily basis. And I can say that my demography for my patients is extremely skewed. I have patients that are 80-something years old, and I just recently had a 30-year-old cancer patient. So what I would like to do with my degree is to try and stick into the clinical trial field. What that would allow me to do is to experience on a first-hand basis with patients, with doctors' offices, with pharmacies, the experience they're having with certain medications and what they can do for particular disease states, especially things like cancer. I really want to work with children, and if I can find something working with children in the clinical disease states, that would be my dream job. But it can also be a sad field when you're having to deal with cancer patients at a young age and you're trying to figure out which medications may or may not work for them. So although today's medicine, it is very modern and it's only getting better, but we shouldn't have to rely on medications to prevent these disease progressions. If there's any possibility of me being able to take the data studied and researched during these clinical trials and being able to implement some kind of prevention program or implementation program that would help prevent or even stop the progression of the disease, it would be absolutely a lifesaver for some patients. If they can take some kind of preventative measures or something that might even slow down the progression of their disease, it would help our future come to such a better healthful state that they may be able to prevent some of these long-term diseases that we're hearing about today. The reason I chose this major is because I wanted to stick some kind of health field, but I didn't want to be a doctor. I didn't want to be a nurse. I wanted to do something that would be able to help people without actually having to be in the health setting, such as a nurse. I don't like blood, so that would be bad for me. Anyways, I didn't want to be strapped down to something like math or science, where it was extremely broad, but in the same sense it's very confined. You can really only work in some kind of math field or science field. I wanted something that was broad enough that we could expand, but focused enough to where there was a clear definition of what you're doing. And I think health education really has pinpointed it, for me at least, knowing that I do have a focused definition of what my career path is and something that is my passion, which is helping people. Me personally, I have my own health issues, so on a day-to-day basis, I try to implement things that I learn in class and in research and things that I do in my own spare time, so that maybe if I can fine-tune them, I'll be able to help someone in their futures. So overall, my goals are to be able to help people in their futures, create prevention plans to be able to help our future be a healthy one. Thank you.